So hello guys, welcome to our channel Niperian Solutions. So today we are going to discuss about very important topic, that is the immunoglobins from your microbiology. So that is very important for your MPSC drug inspector exam. So immunoglobins, what are the immunoglobins? These are nothing but your glycoproteins. Okay, so let's start with the immunoglobins. Okay, here in this table I have construct all the data which is very important. So first one is, we know the 5 immunoglobins are there: IgG, IgA, IgM, IgD and IgE. So the first point is the molecular weight, right? So the molecular weight, so IgG is having the smallest molecular weight, that is in the Dalton, and IgM is having the highest molecular weight. So we can say the IgM is largest in size because it is having highest molecular weight. So IgM is the largest in size, and which one is the smallest in size? That is your IgG. So from molecular weight, these 2 points are very important: which one is the smallest in size and which one is the largest in size. So the second point, the serum concentration. Serum concentration is like mg per ml. So IgG is having 12 mg per ml, means it is highest among the all antibodies, 12 mg per ml. So it is largest in number. That point, largest in number, is very important regarding the IgG. And the smallest in number, that is your IgE, that is 0.00004. okay, so largest in number and smallest in number, please remember these two one. Then again half life is also very important. So which one is having the highest half life? That is your IgG again. And which one is the shortest half life? That is your IgE. Then which immunoglobulin crosses the placenta? So placenta is crossed by only one immunoglobulin, that is your IgG. Very important, IgG is very important. Okay, then present in breast milk, the IgA is having highest amount, right? Very minute quantity with IgG or very negligible. Please concentrate on the IgA which is present in the breast milk. Then selective secretion by seromucous gland, that is again your IgA. okay, selective secretion by seromucous gland. And the heat stability, all immunoglobulins are heat stable at 56 degrees Celsius except IgE. Here you can see, that is no, IgE is not stable at 56 degree Celsius. So from this table, I think all the important points that we have covered. So please remember molecular weight, highest and lowest; serum concentration means largest in number and smallest in number; then half life, longest and shortest; crosses placenta, only one antibody, that is IgG; present in breast milk, only one, you have to remember IgA; selective secretions by seromucous gland, please remember IgA; and the heat stability, all are heat stable, but please remember which one is the heat labile, that is IgE. So this table is very important. I think we have covered all the points, right? Okay, here I make another table with different features of immunoglobulins. So first one is the which indicate acute infection, that is your IgM. Then chronic infection, IgG. Present in breast milk, mucus and blood, that we have previously seen in the table, that is IgA, very important. And which one is crosses placenta, that is IgG. So please make star mark for this one and this one. Okay, then first antibody detected after infection, that is IgM. Then responsible for hypersensitivity of allergic reactions, that is IgE. Allergic reactions or hypersensitivity means these are the type 1 hypersensitivity reactions or the allergic reactions. So what are the examples? Like anaphylactic shock, allergic reactions, asthma, all the allergic reactions in the type 1 hypersensitivity reaction. So which one is responsible? That is IgE. Then differentiation of beta lymphocytes, that is IgD. D for differentiation of beta lymphocyte. Okay, the next, causes mast cell to release histamine. So histamine, again we know the mast cell that is responsible for your allergic condition. So that's why here IgE is correct one. The next, protection from gram negative bacteria, that is IgM. Done. Next, longest half life. Just we have seen the IgG is having the longest half life, and what is the shortest half life, that I didn't mention here, but the shortest half life with IgE, and the heat labile at 56 degrees Celsius, that is your IgE. Okay, so these two tables, previous one and this one, these two tables I think more than sufficient for your exam, so please go through it, that two tables. Okay. Okay, here are some previously asked question in your MPSC drug inspector exam. So which of the following is referred to as mucosal antibody? So just we have seen which antibody is present in breast milk, mucus and blood, that is your IgA. Okay. Next, type 1 hypersensitivity reaction are usually mediated by. So just we have seen type 1 hypersensitivity reactions is mediated by which one? That is your IgE antibodies. Okay. So what are the example of type 1 hypersensitivity reactions? So these are the anaphylactic shock or the anaphylactic reactions, then your atopic reactions, Krushner reactions, asthma, all the allergic conditions. Okay. So these are the example of type 1 hypersensitivity reactions. So please remember, because sometimes they are giving the example and asking which immunoglobulin is responsible for this one, right? So the next one, which type of antibody causes anaphylaxis leading to vascular dilation and edema leading to inflammation? That is again the same question like anaphylaxis. So they have given the anaphylaxis type of reaction and which immunoglobulin or the antibody is responsible for that one. Again, that is your IgE. Next, type 1 hypersensitivity reaction is mediated by. Again the same question that is asked in your recent Assistant Commissioner of Drugs 2023 in MPSC. Okay. So what is the correct answer? Here is also IgE. So that's why immunoglobulin is very very important topic. So at least one or two questions definitely there in your exam from your immunoglobulins from microbiology. Okay. Okay. So here the immunoglobulins with different H chain. So actually we can simplify it, that nomenclature of your immunoglobulins or the antibodies depending on your heavy chain present in that specific immunoglobulin. So similarly we can say the gamma H chain or the gamma chain is the IgG, alpha chain is IgA, mu chain IgM, delta IgD and epsilon IgE. So depending on this H chain only your immunoglobulin is like determined or the name is there, right? So these are the very important points about the immunoglobulins or the antibodies. So please remember all the points, that two tables, and this last one is also because they are asking mu chain is represents which immunoglobulin. So again at that time you will get confused, what is the mu, we didn't read somewhere. So that is just remember the first letter of that gamma, alpha, mu, delta, epsilon. So depending on that only the name is there or the specific immunoglobulin is there. Okay. So okay, so finally thank you. So in the next video please comment in the comment box what kind of topic that we should cover, or whatever the difficult topics. I think nobody is focusing on like important subjects like pharmacology, because that is very very important topic. So just go through with KD Tripathi and your Gupta and Garg. So I think these two books are very very sufficient for your pharmacology, so more than enough. So we can cover some topics from pharmacology which are very very important. So this series we can continue with different subjects like pharmacology, microbiology. Again jurisprudence is also very very important. Definitely more than 10 questions are there on the jurisprudence, more than 10 questions are on the single microbiology, more than 20 questions are on the your pharmacology. So I think please consider these are the major subjects and do preparation accordingly. Okay, so thank you so much guys, we'll see you in the next video.